Have your pre-existing conditions been preventing you from getting health insurance? Guess what? That is going to be a thing of the past. I'm going to tell you why right now. How's it going, everyone? I'm Joey Giangola with Giangola Insurance, and on today's health insurance break, I'm going to tell you why your pre-existing condition can no longer prevent you from getting health insurance, starting here in just a few short months. One of the big, absolute, necessary changes that is coming with the Affordable Care Act, or Obamacare to some, or maybe healthcare reform to others, is the idea, or fact, I guess I should say, that pre-existing conditions will no longer be allowed to be discriminated upon when applying for health insurance. Everyone's able to get it regardless of your situation. It is something that needed to be addressed, and it is coming here very soon. This brand new provision of the law is going to take effect January 1st of 2014. You're actually going to be able to start applying for health insurance on October 1st of 2013, which, again, will allow you to get going on that process. But it actually will not start. Your coverage will not be in effect until January 1st of 2014. So what's the catch then? You might be asking yourself, this sounds a little too good to be true. Why all of a sudden can this magically happen now? Well, outside of the federal government stepping in and saying that it has to, what's going to happen now is that the insurance companies are going to operate on what is called an open enrollment schedule. That simply means that you cannot buy your health insurance whenever you feel like it now. You're actually going to have to do it within a very specific time frame. Otherwise, you will not be able to add or remove or cancel or change your health insurance. That open enrollment window is going to now exist, at least for this first year, from October 1st of 2013 all the way to March 31st of 2014, giving you, if you the simple math, 6 months to make that decision and get something done. If you decide on April 1st that you want to buy health insurance, well, you're going to be too late because you are no longer allowed to buy health insurance after that enrollment period closes. Of course, there is the one exception of having a qualifying event, or basically a fancy word for exception, to that coverage, in which, something like if you lost your job, or if you got married, if you had a child, certain things like that. They haven't released we haven't seen a specific detailed list of what those qualifying events will be, but I would imagine that they would look similar to what currently exists within any group plan that you're on right now. All right, so what's the other catch? There's still got to be something. You're still not feeling right about this. Still feels too good to be true. Well, the other catch is things are going to get a little more expensive. When you start covering more conditions, more people, everyone for everything, as I've said, those conditions come with a cost. Before, if somebody had severe heart disease or had a terminal cancer, diabetes, any type of chronic conditions, Parkinson's disease, anything like that costs a decent chunk of money to maintain or treat, well, that cost has got to go somewhere and has to be absorbed by everyone else that's paying into this kind of system, if you will. There's been a ton of numbers tossed around as far as how much you can expect to pay, from 88% initially to I've seen 81 to 44 to 53. I can throw out a ton of numbers, but actually the most recent number that I've seen from the Ohio Department of Insurance itself released that around 41% is the number that you can expect your health insurance to increase next year. Now keep in mind that is unsubsidized premiums, so if you do qualify for a tax credit or subsidy through Ohio's health insurance marketplace, well then that number is going to be significantly less. So the last question that you might be asking yourself is why couldn't this happen before healthcare reform? Well, again, as the system is currently set up, you can buy a health insurance policy whenever you want, meaning you can also cancel it whenever you want. There is no limitation or stipulation for how long you need to carry it or not carry it. It's just there when you want it, there when you don't, and there's a lot of freedom there. Along with that freedom comes with the necessity for insurance companies to then underwrite or discriminate or basically evaluate. A lot of eights going on there. The actual people who are being approved for this coverage, because if you can just get it, no questions asked, whenever you want, however you want, well, then that opens them up for what we call adverse selection, and people who only need it will be the only people that buy it, and the people who buy it will not be able to fund enough money to pay for those services and treatment. Basically, there would be no money to cover those medical procedures if the people that didn't need it didn't buy health insurance. Hope that made sense. I probably could have done it better, but such is life. The insurance companies don't print money. That's how the exchange of funds works. It is simply a finance tool to help you manage those costs when they come around. Well, what's the bottom line then? Again, like I said, the fact that you were unable to buy your health insurance on your own if you had a pre-existing condition was something that needed to be corrected. However, forcing everyone to buy coverage and limiting the amount of choices that you're going to have might not have been the best way to do it. Again, we will find out very soon how this is all going to shake out, but it's going to be your job in that time span to make sure that you're making as informed a decision as possible and that you know what your options are and when they're available. You can go ahead and do that by downloading our free guide, How to Understand Ohio's Health Insurance Marketplace. You go ahead and click on this ebook cover right here. It's going to take you right to it, and it's going to give you access to the best information that we have available right now as far as helping you make an informed decision about Ohio's health insurance marketplace. Again, if you want to, there's going to be a link additionally in the video's description to click on. If you don't like to click on videos, things in here, you can go ahead and click on that link in the description as well. But go ahead, download your free guide. Let me know what you're struggling with, and we'll help you start making that best decision. But again, I am Joey Giangola with Giangola Insurance. Take it easy, everyone.